Now, live, this is 8 News Now at 4.
The battle against addiction is an ongoing struggle for some very young people here in the Valley.
Up next, we sit down with an addiction specialist to break down the problem in our state and how you can get involved in the fight to end it.
Welcome back as part of National Recovery Month. Today is Addiction Professionals Day. Joining me now is David Marlon. He's president of Solutions Recovery to talk about how his organization is raising awareness of addiction in both adults and children. Dave, thanks for joining us.
Thanks for having me, Paul.
Well, you are a very good person to talk to when it comes to this issue. You've treated thousands of people over the years. At what age do typically abusers begin to experiment with drugs or alcohol?
We ask our clients here in Las Vegas, and the average age we see is they started at 12 years old. As a parent of a 14-year-old, that's startling to me.
That's quite young. Typically alcohol they begin with?
Alcohol, but more and more we're hearing the new gateway drug is prescription pills, where kids will swipe them from a family member or a relative, and they'll try a pill because they think it's safe.
Right, they're easy to get to because so many of their parents have them in the house. You saw a spike in admissions this month.
We did.
What's that all about?
Part of it is it's Recovery Month. And in Recovery Month, there's many events, and people, I think, are more aware of recovery. We've been getting better at having our hand out and our doors open to help people.
For someone who may be unsure about how to approach a loved one who they believe may have an addiction problem, what's the right way to do it?
Well, if you feel someone is struggling, helping them to get an assessment is a really safe, fair thing to do. Now, if they refuse it, you can't force them to do it, but what you could do is build healthy boundaries and say, as long as you're going to be abusing drugs or alcohol, you know, I'm not going to support you or perhaps even be around you.
That's the big question, when to really put your foot down and have that intervention, if you will.
Yeah. Rather than pushing for the intervention, I encourage people to just get someone to get an assessment. It's a non-invasive, non-threatening thing as opposed to getting the whole family together. Just have them come down and get an assessment with a mental health professional.
But when it comes to getting better, it's not the recovery center that's going to make you better. That patient has to be really dedicated to getting better themselves, right?
Well, there's two processes. There's a physiological process where if a person is dependent on opiates, they need medical help. They need to be separated from that drug medically. After that, there's a psychological process, and that takes a much longer time, and we're celebrating Recovery Month because it's a lifelong process.
David Marlon from Solutions Recovery, thank you so much, and thank you for the work that you do.
Thanks, Paul.
We'll be back with more after this.